Hello Malaysia and welcome to episode 4 Medical Day right here on the Bernama News channel. I'm Jared Ratnam and as always we have a variety of topics for you in an hour packed with interviews and also videos. As always we begin with our aging and well-being segment, and joining me in the studio is Dr. Navindra Nageswaran, who's now a usual suspect on Medical Today. He's the Managing Director of Global Doctors. Joining him is someone, a blast from the past, who's going to make it into the future, Tan Sri Kamal Salih, the chairman of MIER. He was the executive director back then. He's now the chairman. Tan Sri, welcome, and thank you very much for taking time off to be with us right here on Medical Day. A lot of questions to talk with regards to your life and your career, so much, and there's so much coming in the future. But apparently, I've been given this question. It's pretty odd for me to ask you this question. How old would you like to live up to? And assuming, let's take into essence now that your health is generally good at this point, how old do you want to see yourself grow to?
The gold standard, Jared, is Tun Mahathir.
Mm-hmm. Tun Mahathir is now moving into 94 already.
94,
yeah. So you're going for 94 or above that?
I don't know whether you can go above Tun Mahathir.
Well, what do you think?
I think you can.
Yeah,
like we previously mentioned, it's all in the mindset and the goals you want to achieve. And if you strive towards it, I think we can manage it across a century, like cricket.
So congratulations firstly on you becoming the chairman of MIER. You've gone full circle and you've come back. What's the feeling like, Tan Sri?
Well, it's an opportunity to contribute to the new phase of our economy. So yeah, it's a challenge that I love very much to do.
Right. Of course, today we're talking about aging and well-being. Let's move into the aging population, the problem of aging population, and we're going to delve into the GDP a little later on. You've got a question for us, Doctor, but why is the aging population a problem to us?
Mainly, number one would be the cost factor. As people grow, the demand for healthcare becomes more and more predominant, and the funds are not there, because generally what happens is that many of them have depleted their EPF funds, they depleted their retirement funds. Insurance is not able to give you an insurance policy. So I think finance is one of the biggest component.
Finance is one of the biggest components. What do you think are other factors that play around finance?
Indirectly, social economic status.
Now, when you say finance, how should finance be managed in your opinion?
I think you have to pre-plan this much earlier, like like we were mentioning about keeping well. You have to start it now, so in 20 years' time you can reap the benefits. Like in business, they always say returns of investment. So you invest in good health today, you can reap the benefits in 20 years later. So you have to plant the seeds well and save them well.
Tan Sri, I want to come back to you and ask you about our country, our beautiful Malaysia. Is Malaysia an aging population in your opinion?
Well, we are beginning to face an aging population as the proportion of those above 65 increases over time. In fact, the right now is about 2.4. By 2020 probably will be about 3 million. But in population economics, the aging process will reach a stage where as the thing increases, by the so-called our population will begin to decline from 2040, which means that up until then there's what is called a population dividend, meaning that any additional population contributes to GDP. But by the time the population begins to decline, then that's the end of the population dividend. So we're still reaping that benefit. But as Navin says, the cost of maintaining an aging population, we are now approaching that stage where it's going to keep on increasing.
Because you're economically savvy, you see this in a different light. For those of us who are not economically savvy, how does the aging population affect our economy in simple terms?
Well, you'll find that the net contribution of the aged, then when they go out of the workforce, begins to be drawing from the economy rather than contributing. So that's why delaying their retirement is an example of how we can improve productivity in contribution.
Right.
So you can get second careers going and so on. So if you are retired too early, then their contribution will be taken away from them.
But I think the bigger question for us in Malaysia is, what is the retirement age now that some are still chugging along in their 90s?
Sure, I mean at 60 is the official retirement age, mandatory, but people are still thinking and they can contribute ideas and so on.
Right.
In fact, their experience is more important in terms of productivity than merely new entrants.
Doctor, I'm going to come back to you with the aging population. Let's talk about the consequences of an aging population right here in Malaysia and also in the region.
I think the first thing again is the cost. One of the problems in the aging population leads to frailty, leads to malnutrition because of, again, social economic status, don't have the funds to buy all the things that you want to buy, so there's frailty and malnutrition. And that will lead to illness, chronic diseases, like what we mentioned it in the earlier show. And the consequences is that, again, cost to the public health or to the government, and also cost to the family, who is actually taking care of the aged persons.
So I guess the bigger question now is, how do we devise a mechanism as such to move forward and to bolster this or to buffer this for the aged in time to come? How do you think we can do this, Tan Sri?
Well, in terms of the cost, one, to the government, there were issues of the sustainability of the pension fund to support services to the individual, and there's also called the cost to the family. As the family, the parents age, then the dependency cost goes up. But from a national point of view, we must prepare for this time, and through ensuring that the healthcare system can provide for it, adequate housing and services related to care for the aged are provided for and so on.
Right.
So if we don't, there's a tendency for the cost to continue to go up. So there must be enough of forward planning to enable for us to maintain and contain that cost increases.
So when we talk about the healthcare system, I think we always have to fall back on primary healthcare, which is so important. Would you like to weigh in on this, Dr. Navindra?
The thing is, as we discussed, the primary healthcare is the gatekeeper of the whole healthcare system. So if we do focus on preventive, we can actually help out the whole healthcare system. Reduce costs, exactly. Because so basically what you need to do is, rather than treating diseases, try to prevent them. Like what we discussed, keep them healthy. So you need those things that we discussed, the day one, the community, the NGOs, all must come and play a role to keep them healthy, because that will indirectly keep our costs lower.
So everyone must be engaged, and you have to keep people engaged at the same time. So this is something we need to look into. Now with primary healthcare, still with you, Dr. Navin, with primary healthcare, you need to be well trained, as opposed to what the psyche is. Primary healthcare is just basic doctoring. But there's a lot more to be done with primary healthcare. What can be done at this point?
I think you should allow the training itself. You should look at the perspective of preventive health and primary care. Primary care, rather than just treating chronic diseases like the NCDs that we talk about, but you can prevent it much earlier. Like, just take diabetes. If you spend more time with your patient and try to see them more frequently, you can actually pull some of the medicines down. You can reduce it. But if you just do something called as continue the same, which is much easier to do, eventually what will happen is the cost will impact to the government and to the private.
Right, that's why I want to quickly come back to you and look at the economic impact. Anything else you can give us with regards to the medical well-being of the nation and the economy, things we need to know as Malaysians at this point?
Well, in terms of performance in developing or more developed countries, there is a tendency for the cost of healthcare to rise, and at the moment it's about 4%. As far as Malaysia is concerned, 4% or just under 4% of GDP is on health expenditure, and there's also a lot of so-called out-of-pocket expenditure, which is about 38%, which is very high. in developed countries, I mean, all of this should be taken care of through either the state or through private health insurance. And we are looking at a situation where the country is now facing the need to reform our healthcare system so as to shift away from hospital-based towards more primary-based. And that's one way to lower the cost to the government and create greater access to healthcare, quality healthcare.
Right.
And in that context, then this shift towards primary care becomes moot in the sense that we need to have trained personnel. At the moment, we have about, for instance, about 900 public and private sector family medicine specialists, for instance. Right. We need about 20,000. So there's more personnel to be trained. Even down in the health team, the nurses and the GPs and so on have to also be accredited so that they can then handle this shift towards primary care.
Right. We've got about 60 seconds left. Dr. Navin, I've got a question for you. According to a new retirement index from internationalliving.com, Malaysia is an ideal retirement destination in Asia. This was in 2018. What are your thoughts on this?
Malaysia is now currently number 2 after Costa Rica. The simple reason is cost again. People who retire in the UK and the US, if they look at the money they have and they do the exchange, stay in Malaysia, especially Langkawi is a fantastic place. We got high humidity, you got good air, you got clean beaches, and then you have the cost. Food is much cheaper, so whatever money you took for your retirement, you can live here. So Costa Rica, Malaysia, and then Portugal, Italy, Spain, for those in the Europe will actually enjoy it. Even South America. Right. It's one of the ideal spots.
Fantastic. Tan Sri,
it's a value for money destination.
Value for money destination.
There's no doubt about it.
On that note, I'll have to leave you, gentlemen. Thank you very much for taking time off your busy schedules to join us right here on Medical Day. We just spoke to Dr. Navin and also Tan Sri Kamal, who was right here on Medical Today, joining us to weigh in on aging and well-being. Stay with us. We're going to come back after a short break with another fantastic interview right here on Medical Today.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye. Eyezen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My Essilor lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
Hello and welcome back to Medical Today, episode 4. Jared Ratnam with you. Now we're going to be talking about treating presbyopia through the eyes of the lens. That's our topic for today. And joining me in the studio is Mr. Woon Pak Seong. He's the president of the Association of Malaysian Optometrists. He's also a trained optometrist, a little something we need to look at in this country, training optometrists and having a medical examination for trained optometrists. Thank you very much for taking time off to be with us. I'm very good at digressing, so we're going to get straight into the questions because we have so very little time to talk about what we want to talk about today. Presbyopia is a condition associated with the aging of the eye that apparently results in progressive worsening ability to focus. Now, what would happen if someone fails to recognize the symptoms or get treated?
Okay. Basically, we know that the presbyopia is caused by the, as we age, the lens. You think of our eyes as like cameras. Right inside our eyes is the lens, and the lens gets hardened up. And as it hardens up, it loses its flexibility, thus affecting its ability to focus from far to near. So what will happen is, this is a natural process, and what will happen is if someone fails to catch the symptoms, basically the person will have eye strain, or it may revolve into a headache, and so on. That's pretty much it.
So the symptoms are pretty general, by the way you're talking about it.
Correct.
How do we zone in or hone in on this? Now, you know, most of us get eye strain by looking at our phones all the time, especially those of us in our 40s and 50s. You know, looking at the phone can become a little bit of a task or a chore simply because your eyes start to hurt. So when is it a telling sign for you to go see your optometrist?
Okay, we recommend a yearly comprehensive eye checkup by an optometrist, regardless whether you feel any blur or pain or strain anyway.
Yearly, once a year?
Yeah, once a year. Yeah, so with regards to presbyopia, how do you know whether you have presbyopia or not? As a guide, generally most people above 40 would have presbyopia. How would you know?
Bad news, bad news.
Life starts at 40, right? So what will happen is that firstly, you got to get your eyes corrected fully for distance. Then you bring a printed material or your phone and set it to a reasonable font size and bring it near to you. And if you can't bring it too close to you and you feel a strain or it's blurry, then you have presbyopia.
Right. Yeah. So, that's a little telltale sign for you. You know, when you start doing this and this and you find out you have to read your phone 5 miles from where you are, it's a very telling sign that you have to go visit your optometrist and get it checked. Now, when upon visiting an optometrist, what happens then during the checkup? What can happen, or how do you prepare for checkup? I do understand that you need to rest and get to the optometrist in the morning to have your eyes fresh and ready for a checkup.
I think you can go to an optometrist at any different times of the day.
But you have to be well rested.
Yes, so long as you are not too stressed up, I suppose. Yeah.
So stress is the very important thing you need to manage, right?
So you're pretty, even at the end of the day, if you visit an optometrist, it's still fine. So we go to an optometrist, what they will do is to go to give you the barrage of eye tests, to check your prescription, to check whether the two eyes work together, to check for eye health as well. You know, as we age, we are more susceptible to risk of cataract, glaucoma, and so on. So the whole barrage of tests is done. Right. Then we assess your presbyopia.
So we're going to talk about lens shortly. Let's talk about laser treatment first. A lot of people are opting for laser treatment. What are your thoughts on this?
Laser treatment for short-sightedness as well as astigmatism is great. Laser treatment for presbyopia is a different ball game altogether. Right. So some of the things that they do is to correct one eye for far and one eye for near. It works for certain individuals, but some people have a difficulty of judgment. Right. There are other types of LASIK available. I'm not the expert in LASIK, but based on literature, what they do is it's not even approved in some of the things are not approved in Malaysia just yet.
Right. Yeah. So there's a lot of things that are being worked on or researched on, and also just started in various countries, but we haven't started it here.
Yeah, so something like Presby LASIK is already available in Europe, but it's not even approved in US yet. Right. But I won't be the expert in this. The eye specialist will be expert in this.
So let's talk about what you are an expert in. Lenses, that's something which is just down your alley. So when we talk about lenses to treat presbyopia, as you're saying, or presbyopia, tomato.
Okay.
What would your advice be, or rather, what is out there in the market for us to look at with regards to lenses?
Yeah, so if you look up the website, then the most common way to correct presbyopia is with lenses. So lenses, you fall into two categories. One is contact lenses and one is spectacle lenses. So we're going to talk about spectacle lenses. So spectacle lenses, if you're, say that you don't have any problems at far at all. So then the most basic type of lenses will be just reading glasses.
Right.
Yeah, so if you wear reading glasses, then you will be able to see far, you'll be able to see near.
Now, the lenses that are used for surgery, can you comment on that? Can you give us, what do you know about this?
Lenses for surgery, you're talking about, there are lenses that, a cataract surgery?
Right.
So cataract surgery lenses are those that's implant inside the eyes. So those style lenses, you have two types. One is a monofocal and one is a multifocal.
A monofocal and a multifocal.
So monofocal, what they will do is they'll give you an option of implanting both eyes to see far, and then you need to wear reading glasses. Or they give you an option of one eye seeing far and one eye seeing near. Now the other option is called a multifocal implant, where with each eye you'll be able to see both far and near. Again, the eye specialist would be the specialist in that. But back to spectacle lenses, we talk about reading glasses. The other type is called the bifocal. So bifocal, like bicycle, is two. Right. So that means you can see far on the top and bottom can see near, but those come with generally comes with a line. Yeah.
Tell me about something I know.
Yeah. Then the next one would be multifocal or progressives. Where
so they're called progressives.
Yeah, so it's called progressives in one place and they're called
so it doesn't have that line, yeah?
So it doesn't have that line. So far is on the top and bottom is for near, and it's smooth and it's gradual and gives you clear vision at all distances.
Right, but with progressive lenses too, apparently it also depends on what you're getting. There are also blind spots within these lenses, depending on the grades.
Typically, the progressive lenses, if you look at the extreme bottom left and bottom right, there'll be a little bit of blurriness. But basically, the new lens has evolved a long way.
It's come a long way.
Yeah, it's come a long way.
I wonder why, not lenses, but of course, the frames for reading glasses have not changed for years. It's something we need to look at to make it look a little bit more hip. Just putting that comment out there, just so someone picks up on this. But no, with presbyopia now, when you get progression lenses or progression lenses, you need to get used to them. What's your advice, or what would your tip be for us in order to get used to these things? Because some of us take them out, put them on, take them out, put them on, because it can be a bit daunting going downstairs, climbing upstairs. You need to change the way you move yourself, especially your head. Well, what would be your tip?
Maybe we can go to how to choose a progressive, and we can go right to that.
Yeah.
So to get a great progressive, few things are needed. First thing is to make sure your prescription is correct. Number two,
by a trained optometrist.
By a trained optometrist, yes.
Yeah.
And two, choose the right type of lenses. There's so many type of lenses available nowadays. Lenses to suit different lifestyle, work, as well as what you need to see.
I have to stop you there very quickly. When you say choose the right kind of lenses, how can I pick the right kind of lenses for myself?
So, for example, like your optometrist should ask you, what do you do for a living? What are your hobbies? And so on and so forth. So, for example, like if a pilot, definitely far is important. For an accountant, near is important. And then you have different jobs and different distances, so that people can, so the optometrist will be able to guide you on what type of lens is available and which one will be good for you.
So, I mean, in a nutshell, it depends on your lifestyle, and you have to give your optometrist exact information for him or her to be able to make that call as to what's available out there for you.
So to make it easy, it's like cars. So whether you go off-road or you're going to drive it, where you're going to drive it, you're going to drive speed, you have family, and so on and so forth. So based on all these options, you'll be able to narrow down the one that is good for you.
Right.
So having said that, so one is a prescription. Second thing, get the right lens. Third is to make sure that it is fitted properly. That means where your position of your eye on the lenses, how high it is from the bottom of the lens, how far away, how tilt, how curve, all these parameters taken to customize your lenses. Then finally, the optometrist will need to teach you how to use those lenses.
Right.
So basically, when you go down the stairs, you got to probably tilt down a little bit more. And when you look at things on the corner, on the side, you probably have to face. But basically, face your reading material, face what you need to see, and so on. So if there's a pretty girl at the corner, you have to turn to see the pretty girl.
You must.
You can't look at the corner anymore.
Yeah. But before I let you go, your message to Malaysia with regards to optometry, or how it's changing or evolving very quickly around the world and also in Malaysia.
Right. So optometry has changed so much. We have better machines, better tynoxing machines, better measurement machines, and so on. And likewise, lens has evolved so much. Do you know that there are now custom lenses available? So custom lens, multifocal lenses that suits your lifestyle. The questionnaire is given to you. You'll be able to customize everything.
Right. With that, Woon, we'd like to thank you for taking time off to be with us. We just spoke to Woon Pak Seong, the president of the Association of Malaysian Optometrists, right here on Medical Today. We're going to take a short break and come back with more. Stay with us right here on today's edition of Medical Today. I'm Jared Ratnam. Thank you very much, Woon.
Most welcome.
Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired dragon eye. Eyezen.
Ask your eye care professional. See more, do more. Essilor.
Hello and welcome back to Medical Today with me, Jared Ratnam. I hope you enjoyed those two interviews we had for you earlier on. In this next segment, we look at bariatric surgery, weight management, and obesity options. We did speak to Dr. Lim Hui Chean, consultant/general surgeon for upper GI from Regency Specialist Hospital. We also had Ivy Gan, who's a dietitian from the Regency Specialist Hospital. Our host, Nurata Amin, spoke to them.
A recent report states that Malaysia has been rated the fattest nation in Asia. The report also showed that 49% of women and 44% of men in this country were found to be obese. Now, this can be a very big problem because it will definitely have implications on diabetes, heart problems, and others. Today with us on Medical Today, we have Dr. Lim. Welcome to the studio. So, Doctor, what are your thoughts on this?
Yes, we know actually Malaysia has been actually rated being the fattest in these regions. We started to know this actually the statistic back in 2011. We are the fattest in Southeast Asia, and now we have ranked actually in the #1 in Asia. There are many reasons why actually Malaysians are being obese or overweight. Okay, Obesity actually basically classify if your body mass index actually is more than 30, and for overweight is anyone with a body mass index of more than 25. So Malaysians, almost actually half of the Malaysians actually are overweight, and out of these portions, about 20% of them actually are obese, which means actually they have the body mass index of more than 30. There are many reasons why Malaysians are obese. One of the top reasons is we are being surrounded by food paradise. For example, a meal of actually nasi lemak, in which actually most Malaysians will consume every day in the morning basis for the breakfast. And on top of that, they'll add on actually with a piece of actually fried chicken, with a cup or glass of actually a teh tarik, in which actually they can actually contribute to their actually daily, half of their daily requirement of calories. If this carries on for the lunch, for the dinner, definitely actually they have actually more excess actually of actually energy in their body, and this leads to actually obesity or overweight. On top of that, being a Malaysian, we are actually having a sedentary lifestyle. We actually drive the doorstep, you hardly walk around, you hardly actually jog around or actually cycle around. So these are the two main actually reasons actually why Malaysia actually being an obese nation.
Right. So doctor, how would you advise Malaysians on weight management?
As you know, actually overweight or obesity actually carries a lot of risks to those actually being actually obese. So because they can actually develop diabetes, hypertension, heart disease, even strokes. So I would strongly advise any Malaysians, okay, who are being obese or overweight, they do have to take care of their diets. Okay, they do have to start doing exercise, because this is actually how to burn off the excess actually calories in the body, to burn off actually excess fat in the body, taking care of what actually they choose to eat. They will actually control the amount of actually calorie they take every day. Those who actually fail to do this actually themselves, probably they need to seek actually medical advice on actually how to actually further manage their weight issues. Weight issue can be actually a very complex problems. To a certain group of people, this might be actually a small issue because it doesn't actually cause them to have any medical complications. For example, I know they don't have actually any joint pain or back pain. But to certain people who are just overweight, they might already started experience actually back pain, joint pain, in which actually it has to be individualized to everyone.
Right. So are there other alternatives to lose weight?
Yes, definitely there are many alternatives on how to lose weight besides actually taking care of diets and exercise. There are actually products, for example, like medications, which actually can help people to lose weight. Okay, they can join actually some programs in which there is a coach to lead them how to actually lose their weight. Okay, if all those things fails, surgery is actually options, which is a bariatric surgery.
Oh, okay. So how is bariatric surgery performed, and what are the pertinent removals from the body?
Okay, bariatric surgery is not like cosmetic surgery in which actually they do liposuction to reduce the amount of fat from the body. In this surgery, what we do is to reduce the size of the stomach, or to do actually alteration in the gastrointestinal tract, so that actually the amount of actually food intake actually has been reduced, and also there will be hormonal changes in the body. For example, the common actually procedures surgery we do is a sleeve gastrectomy, in which actually we reduce the size of the stomach to almost 15% of its original size. So someone who has actually undergone this surgery, they only actually able to consume actually very little amount of food. On top of that, they also actually reduce actually the hunger sensations, and also the absorptions will be less. This is actually pertaining to sleeve gastrectomy. In those actually with diabetes or many other medical complications, we actually advise them actually for more complicated surgery, for example, like gastric bypass, in which actually we create a small pouch in the stomach, and we bypass actually the proximal or the first part of the small intestine. In this way, actually, the patient will get actually less amount of food, there are less absorptions and less digestions. This is the two actually common surgery we do in bariatric surgeries nowadays.
All right. Okay. So talking about before and after, how to ensure a patient looks good after the surgery?
Okay, this surgery, in the olden days, actually, we do it actually in open methods.
Okay.
Okay. Nowadays, we do it minimally invasive, or what we call keyhole surgery. So after surgery, the patient actually only having a few keyholes on the abdomen, and then they experience actually very little pain and very minimal blood loss. And they actually, most of them actually, being discharged from hospital day 3 or day 4 after the surgery.
Okay, so is there any long-term or short-term side effects?
Yes, surgery, as actually we know, is not without risk. There will be actually short-term and long-term side effects. Okay, short-term side effects, for example, like complications from actually anesthesia. Patients actually undergoing actually surgery may experience actually nausea, vomiting, pain, okay, giddiness, and for pertaining to surgery itself, they may actually develop bleedings, leakage from the surgery, and sometimes actually even infections from the surgery itself. For long-term complications, most of them, they will develop weight loss, but during the weight loss procedures, during the journey of weight loss, they may actually develop malnutrition because of actually not enough of nutrient being absorbed in the body, and the amount of actually food they take has been reduced. So they can develop actually hair loss, skin actually may turn very dry, they may actually having actually anemia.
All right. Suddenly it came across my mind, would counseling or psychiatrist advice be required for the patients?
For those actually who is going through surgery, first they have to go through a counseling session. Okay, they need to be actually preferably
mentally prepared.
Yes, be actually seen by a psychiatrist, because they need to make sure actually those who are going for surgery, that doesn't have like things like eating disorder, okay, or they are not in depression or any psychiatric illnesses. Yes, definitely they need to go through this. Besides this psychiatrists, they also need to go through actually others actually examinations to make sure actually they are safe to go through the surgery.
So, coming back to bariatric surgery, will there be hormonal or emotional disorders after the treatment?
I wouldn't say actually they will develop hormonal or emotional disorder. I would think actually there are more hormonal actually and emotional improvement after the surgery.
Okay, how's that?
So for example, those actually having diabetes, after surgery, because actually the amount of food actually intake is reduced, and actually the hormone changes in the body, the insulin has been increased, so their diabetes actually get cured or actually improve markedly after the surgery.
Right, okay.
Yes. Emotionally wise, for someone who are actually obese, they lost weight, they looks good.
True.
So they gains their actually self-confidence after the surgery.
Okay. So do you have any interesting case based on your experience, doctor, that would like to share with all the audience that this is something that we should, let's say, go through, and even though probably it might incur costs, but it's actually worth it?
Yes. I have this particular case actually in my past practice, in which actually he actually had fracture himself. Okay, he has a lower limb fractures because of weights issue. He weighs about 300 kg. Okay, was actually bed bound for more than 2 years. No surgeons would like to operate on the leg because no implant going to hold the weight.
Right.
So the only option for him is to go through bariatric surgery to lose weight before the orthopedic surgeons actually can fix up the leg. So he went for surgery and he lost about 150 kgs in a year, in which actually he successfully gone through the surgery for the legs, and now from bed bound he's able to walk with crutches. So he has actually undergone through the through the whole journey. Of course, there are risks involved, but we have to look actually what are the benefits actually he regained after the surgery.
All right. So did he sustain?
After 4 years plus, actually he still actually sustained actually his weight loss. Of course, to a certain extent, some people, if they don't actually stick to a or they don't have a discipline in their life, don't change actually behavior, okay, of their lifestyle, they may actually regain back their weight to a certain extent.
Okay, so how can one person who is obese to sustain in the long term? This is very important,
yes.
I think.
Yes,
especially for Malaysians.
Yes, it is actually very important. So I would like to mention is surgery is not a key factor to lose weight. You need to couple with other things, lifestyle changes, diet changes, okay, behavioral changes, in order for them to develop, or in order for them to actually have a lifelong weight loss.
All right. Thank you, Dr. Lim, for joining us on Medical Today.
Thank you.
For the patients who will be undergoing bariatric surgery, at least 2 times of visits with the dietitian and a minimum of 3 times after surgery. For the appointment before surgery, dietitian will assess on their eating habits and nutrition status, setting goals for the patient to work on to improve their nutrition status before and after surgery. Yes, patients need to go on a diet before surgery, as most bariatric surgeons will put their patients on a lower calorie diet before surgery, as this will help to shrink the liver size and reduce the fat in the abdomen, which then helps the procedure to be safer. Once the surgery is completed, patients will need to go through a special diet that consists of clear liquid, full liquid, pureed foods and soft foods. Clear liquid, example, clear soups and strained fruit juices. Full liquid, example, oral nutrition supplement drink and yogurt drink. Pureed foods, example, foods that can be mashed like mashed potatoes. Soft foods, example, like porridge. After that point, patient will return to their normal diet about 6 to 8 weeks, but depends on individual's condition, taking solid foods. There are a variety of problems that patients may experience after surgery. One of the common problems is dumping syndrome. It happens when patients have too much of fats or sugars in a short period of time, but it can be prevented by avoiding foods that is high in sugars or fats and refined carbohydrates, for example like cakes and pastry. Other common problems like diarrhea, constipation, food intolerances, vitamins and mineral deficiencies may happen as well. When my patients having problems after surgery, we do encourage them to come back to see us. This is very important as we could analyze what they are eating and give them some guidelines to make the diet plan more effective.
I do hope you enjoyed that interview. We spoke to Dr. Lim Hui Chean, Consultant and General Surgeon, Upper GI from Regency Specialist Hospital, and also Ivy Gan, who's a dietitian from Regency Specialist Hospital. Now, we talked about bariatric surgery, weight management, and of course, obesity options right here on Medical Today. We're going to take a short break, and when we come back, we have a special video for you right here on today's edition of Medical Today. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never-tired Dragon Eye, Eyezen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
Hello and welcome back to the final segment of Medical Today. I certainly do hope you enjoyed the video on bariatric surgery. Now, before we let you go, we have a very interesting video for you. Here's a question for you. Do you know CPR? If you don't, watch our video on our accidents and incidents segment right here on Medical Today. Take a look.
Hello, are you okay? Hello, are you okay? Sir, call ambulance 995 and get me an AED.
Yes, sir. Okay.
One, two, three, and four, and five, and 1, 2, 3, 4, and 10, and 1, 2, 3, and 4, and 15, and 2, 3, 4, and 20, 1, 2, 3, and 4, and 25, and 2, and 3, and 4, and 30.
Hope you enjoyed that video on CPR right here on our accidents and incidents segment. Of course, if you do have any questions for us, what you can do is send us an email, send it to ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll give you all the information you need. If you have any questions that are pressing, we'll bring subject matter experts to, of course, weigh in on your questions right here on Medical Today. Just to give you a heads up, next week on the show, we'll be having Dr. T. Ruben Raj, a resident consultant physician for internal medicine and gastroenterology and also hepatology from Makota Medical Center right here at Medical Today. On that note, on behalf of the team at Medical Today, I'm Jared Ratnam signing off. You have a fantastic day ahead and stay with us right here on BNC.
Thank you.